Okay, welcome to Chapter 5. We will be talking about infection control and standard precautions. We're going to start off with some definitions. I want you to be comfortable with these terms. The first is infection control. This is a set of methods that we employ to control and prevent the spread of disease. And often in a hospital, you'll have at least one, maybe several staff that are in the infection control department, and their job is to implement policies and procedures which will control and prevent the spread of disease. In hospitals, we have some resistant organisms that we're really concerned about, so that department is very important for controlling those things, keeping patients safe as well as staff. Asepsis, this is a condition in which no pathogens are present. Microorganisms, these are very small living things, bacteria, viruses, things like that. They're not visible to the eye, and you need a microscope to see them. Pathogen is any kind of disease-causing microorganism. So when we think about infection, there's what we refer to as the chain of infection. So this is 6 points or 6 links in a chain. So you can see here we begin with the causative agent. This would be a pathogen, any kind of microorganism that can cause infection. So let's say we have a causative agent here. It needs a reservoir, a place that it can continue to live and reproduce. Then it needs some kind of portal of exit. In infection control, we talk a lot about droplet transmission or contact transmission. There's some way that organism is getting out of their reservoir. Modes of transmission, just gave you a couple of examples. So once it's resided somewhere, it's exited, and now it's transmitted to another potential host. So it would enter through some sort of portal of entry. In humans, this is mucous membranes, inhalation of respiratory droplets. That's a common way to transmit disease. When we sneeze, you have all of these respiratory droplets that fly out into the air, and if you're nearby, you can inhale them, and then you are now exposed to whatever that organism is. And you also need a host that's susceptible, that's able to, in other words, kind of allow that organism to infect them. So this is the chain of infection, and you need all of these pieces in order for completion of this cycle. And if we can interrupt this cycle at any point, this is what the infection control department in your hospital or your healthcare center is focused on, is trying to interrupt the chain of infection at some point so that we prevent additional infections. So we could do this in lots of ways. We can do this wearing a mask would be doing it at the portal of entry. So if I wear a mask, I'm preventing, the inhalation of organisms. If I put a mask on a patient that's infectious, that's often even better. Then I'm interrupting here at the portal of exit. If that patient has some sort of infectious respiratory disease, I might ask them to wear a mask so that when they're speaking or talking or sneezing, that the exposure is limited. So lots of ways we can interrupt transmission. Okay, so let's keep going here. There are several organizations in the United States that work towards controlling and preventing the spread of disease, and the first one is the Occupational Safety and Health Administration, sometimes referred to as OSHA. This is a federal government agency that makes federal rules to protect workers from hazards on the job. Everything from construction to hospital workers. So they usually set out policies that have to be followed. The Center for Disease Control issues guidelines about protecting and improving health. And those of us who work in healthcare, we are exposed to a variety of organisms, and we need to protect ourselves. Exposed to lots of fluids, blood and body fluids, so we need to make sure that we're aware of how to keep something, prevent infection. An isolate, this is to keep something separate or by itself. Once in a while, we'll have situations where we have to isolate a patient. It's unusual. It doesn't happen too often, but in some cases. So, for example, we have an active tuberculosis patient, which means that they're able to transmit the disease, we might have them in a negative pressure room or a room where the air is only circulated within that room. It doesn't go throughout the hospital. So we can limit those organisms from flying around. So that would be an example. Let's talk about standard precautions. These are more terms here. We have standard precautions are a set of methods where we can protect ourselves from blood and body fluids, protect them from non-intact skin, mucous membranes, and so on and so forth. So basically, whenever I work with a patient, regardless of their health condition or their situation, I'm always practicing standard precautions in order to limit my contact with blood and body fluids. Body fluids include saliva, sputum, urine, feces, semen, vaginal secretions, pus, anything that would come out of a wound. We want to keep ourselves separate or create a barrier between ourselves and those things. Typically, we use gloves and goggles, masks, sometimes gowns, things like that to limit our exposure. Here's a long list. Oh, and it looks like it's going over the end here, but there's a list in your chapter as well of examples of standard precautions. These are wearing gloves when appropriate, washing your hands. We're going to talk a lot about hand washing. Removing your gloves immediately when you're finished. You don't want to walk around with stuff on your gloves. You might touch something or bump into something, and then whatever you've touched is now exposed or infected. Wear gowns if necessary, if there's going to be splashing or anything like that. Mask and goggles. Don't handle needles or syringes. What we try to do when we're working with needles is completely limit having any part of you or anyone else pass through the front of that needle area. So typically when we're working on a client, we like to have the sharps container nearby so that if we can dispose without passing in front of the needle. So that's a really good rule to follow to limit needle sticks, which sadly is common sometimes. It does happen. I've known several friends who've had to take various medications after a needle stick to limit exposure to something. So anyway, you can read over that list of standard precautions. Hand hygiene. Let's talk about hand washing. This is a very important tool and something that you will do a lot in the healthcare environment. And it's defined as hand hygiene is defined as hand washing using either plain or antiseptic soap and water, or an alcohol-based rub. So we find that those rubs those gels are kind of everywhere. And the idea is that it shouldn't replace hand washing, but it should, if it is available and it's convenient and you're in a situation where you need to wash your hands, the sooner you do it, the better. So if that's an option, it's a good option. So again, lots of examples in this chapter of when a home health aide or personal care attendant should wash their hands. Once you arrive at the client's home, before you touch the client, before and after making meals, before and after feeding, before and after contact with body fluids, all these types of things. Before you put on gloves and after you remove your gloves, we're just trying to interrupt that chain of transmission, either from the patient to you or from you to the patient. And there's a very long list, so you can read that over. Wash your hands before getting clean linen, after taking out the trash, all these types of things, which may seem commonsensical, but you definitely want to be aware of when that's required. So, and again, it's really the most important thing you can do to interrupt the transmission of disease. I think about this a lot. I feel like I'm at the grocery store frequently. I have kids, so whenever I touch that grocery store cart, I'm always thinking about what's on there. So these days, the whole time I'm at the store, I'm saying to myself, "Don't touch your face. Don't touch your face. Don't," So I try to wipe it with the towelette that they often have at the door there, the antiseptic towelette, and I try to not touch my face while I'm shopping, and I try to use the towelette at the end when I'm exiting. And then, of course, I wash my hands as soon as I get home. And I find that it helps. But yeah, you think about someone shopping and sneezing on the cart or rubbing their nose and then putting their hand on the cart, and you just can get kind of worried. So let's talk about hand washing. You need soap and water and towels. There is a procedure, there is a process, so let's go over and talk about it. Let's see. You're turning on the water. You're rubbing your hands together. You wet your hands and wrists thoroughly. Apply a generous amount of soap. Rub your hands together. Create a lather. I've often heard a lot of infection control people say, sing happy birthday to yourself, and that'll be about the time you need to be washing your hands. This book recommends lathering surfaces, fingers, and hands, including your wrists, producing some kind of friction for at least 20 seconds. Clean your nails. That can be a real place that bacteria like to hang out, so I always like to keep my nails trimmed and limit whatever could potentially get caught under there. Be careful not to touch the sink, and this is a big no-no here. You don't want to run water down your arm bringing whatever's on your upper arm onto your clean hands. So don't run water over unwashed arms. It's interesting now when you watch a television show or something, you see surgeons, they're going to be you'll be more conscious of how you're watching them, wash all the way up to their elbows and such. Dry with a paper towel. We often turn off the faucet with the paper towel since we turned it on with a dirty hand, and dispose of the towel as appropriate. So this ends, and again, you can read those. Bit by bit, step by step in your chapter. I'm going to close this and continue talking about infection control in another session. So this will be the end of session A, and I'll see you in session B.